All right, my name is Rachel. I'm going to be your nurse practitioner assessing your head and neck today. Is that okay with you?
Yes.
Okay, perfect. So I'm going to start with your head. I'm just going to inspect your head and your scalp for any lesions, bumps, bruises, your hair distribution looks good. No patches, nothing like that. Okay, good. I'm going to inspect your lymph nodes now. Just tell me if you have any tenderness when I inspect, okay? I have your preauricular here, postauricular here, occipital back here. I have your submandibular, parotid here, submental here in your chin, superficial cervical here, deep cervical here, and the supraclavicular here, lymph nodes, okay? No tenderness when I do that, right?
No.
I'm going to test your cranial nerve 5, trigeminal. Just clench your jaw for me. No issues or pain or tenderness there? Good. I'm going to check your facial, cranial nerve 7, symmetry. I'm going to have you smile for me. Can you frown? Raise your eyebrows. Puff your cheeks. And pucker your lips. Perfect. Okay. Next, I'm going to assess your ears and make sure they look good. Assess their size, position. Everything looks good. I'm going to palpate your auricle, your tragus, and your pinna for any tenderness, anything going on there, pain, anything like that. Okay, perfect. I'm next going to perform a couple tests to see how your hearing is. Okay, I'm going to do a whisper test first. I'm going to stand behind you. I'm going to cover one ear and just tell me what I whisper if you can hear it.
Okay.
ABC.
ABC.
1, 2, 3.
1, 2, 3.
Okay, perfect. All right, so next I'm going to do, you use a tuning fork here, and I'm just going to tell me where you hear the sound best. Okay, so I'm going to tap it here. I'm going to put it against your mastoid bone, the tuning fork here. I'm going to put it in front of your ear. And where did you hear the sound best?
Out here.
In front of your ear. Okay, perfect. I'm going to assess this side as well. I'm going to stop my fork, put it against your mastoid here, and then in front of the ear. And where did you hear it best? In front of the ear. Okay, perfect. Next, I'm going to do the Weber test. I'm going to stop my tuning fork, put it right above your head here in the midline. And where do you hear the sound? On both sides bilaterally, one side more than the other? Midline, normal, both sides?
Yes, normal, both sides.
Both sides equally?
Yes.
Okay, perfect. All right, so now I'm going to assess your external canal, your tympanic membrane. I'm going to check your external canal. I'm going to pull your ear up and back, check for debris, inflammation. I'm going to look at your tympanic membrane. It should be pearly gray white, concave in shape. I see minimal debris, just moderate earwax on this side. Left, the tympanic membrane is at 7 o'clock. The cone of light is at 7 o'clock. I'm going to check the other ear. Same thing, I'm going to pull the ear up and back. Check the external canal for any drainage. Check the tympanic membrane. Cone of light should be at 5 o'clock on this ear. Pearly gray, concave in shape. Looks good. Perfect. Okay. Next, I'm going to check your eyes, check your eyelashes, check your brows, check your eyelids. Those all look good. Normal, no debris. I'm going to check your conjunctiva and your sclera. The sclera looks white. Conjunctiva is moist and pink. That looks good. I'm going to check your eye just for ocular movements. Can you look at my finger without moving your head? Just follow my finger. Good. Perfect. Good. I'm going to also have you look back at that far picture on the wall. And then I'm going to have you look at my finger. Looking for accommodation now. Perfect. Okay, good. I'm going to check your pupillary reaction to light next. Just going to cover one eye. See the pupil constricts in this eye. That's good. Pupil constricts as well. With the direct, you'll see the pupil constriction, and consensual, the other eye will constrict as well. And we can see that happening right now too. Okay, perfect. That looks good. With the ophthalmoscope, I'm gonna also check your, I'm gonna dim the lights, I'm gonna come in at a 15-degree angle, I'm gonna check your retina, your red reflex, your optic disc, your macula, arteries, and the veins. So I'm gonna come in, kind of at this, look at your, yep, everything looks good. That's good for that. Next, I'm gonna assess your nose. I'm gonna check your nose, make sure it's midline, straight, that looks good. I'm gonna look in your nasal mucosa. I'm gonna have you tilt your head back. I'm gonna use my light. I'm gonna check your mucosa, check the turbinates, make sure there's no deviations, no debris. I'm gonna next have you check your patency. So occlude one nostril and breathe in for me. And same with the other side. Perfect, that's good. I'm gonna have you smell something and tell me what you smell.
Peppermint.
Perfect. Next, I'm gonna just assess your frontal and maxillary sinuses.
Oh, sorry.
Frontal are up here. Check for tenderness, and maxillary are here. Any tenderness there?
No.
Perfect. Okay. Next, I'm gonna assess your mouth and your throat. I'm looking at your lips. They're moist and intact, pink. And I'm gonna check your teeth. Open your mouth for me. I'm gonna use my pen light. Check your teeth. Can you stick out your tongue for me? Can you pull your tongue upwards so I can see underneath? Perfect. I don't see any lesions. I see your salivary ducts. Those look normal. I see your hard palate and soft palate. No lesions. Everything looks good. Moist and pink. I see. I'm going to use my tongue depressor to pull your tongue down. And can you just say ah for me? Good. I see your uvula. Rises when you do that with the phonation. It's midline symmetrical. Good. Perfect. Let's see. I'm going to also assess your TMJ for crepitus. Just open your jaw a few times for me. Perfect. Okay. Just open one more time. I want to just double check your tonsils for swelling. Can you tilt your head back a little bit more? Tonsils for swelling. No tonsils. No swelling either as well. Okay. Good. I'm going to check your neck neck next. I'm going to check your trachea for deviation. It looks midline. That looks normal. Can you swallow for me? Good. Any issues with that?
No.
Okay, good. I'm going to have you tilt your head slightly forward and swallow. I'm going to palpate your thyroid gland now. Can you swallow for me? Okay, good. I'm just going to assess for any enlargement, nodules, any tenderness, pain. I'm going to assess from the front and from the back. Good. Good. I'm also going to palpate your carotid artery one side at a time. And I would also use my stethoscope to check for bruit on each side as well. I'm going to ask you to range of motion in your head and neck. So just tilt your head back and forward, left to right. Perfect. Okay, that looks good. I'm going to assess your spinal accessory cranial nerve. So just shrug your shoulders up for me. Perfect. And I think that, do you have any questions?
No, I don't.
And that completes my exam today.
Thank you.